How can we help this mom move her body with or without an epidural, whatever her choice is, so that we're delaying how much pushing she's having to do and we're helping her body go through these movements. This is what I love. I teach patients, here's what we can do in the inlet, here's what we can do in the mid pelvis, here's what we can do in the outlet, and we practice them in pregnancy so that when
So
they're in
good.
labor, they go, oh yeah, okay, I did this one with Margo in the clinic and baby's here now, so I'm going to do this movement. And they know, and they can just go right into it because we practice it over and over and over again.
I always get excited when these things work. How are you, Margo?
I'm doing well. How are you?
I'm doing great. I'm glad we got our video working. So
We did.
first of all, I want everyone to I would love for people to hear kind of who you are, what you do,
Sure.
why you do this work. I just love hearing your story. So I'd love to have you share it with everyone.
Absolutely. So I'm a pelvic floor physical therapist. I work in Ventura, California, which is kind of SoCal. And I got into this work because I had a chronic pelvic pain condition. So I went to grad school and kind of specialized in sports and then got into the pelvic health world. But then I got pregnant with my first and delivered him in summer 2021. Immediately knew something was wrong with my pelvic floor. And eventually, a couple weeks later, was diagnosed with some nerve injury, actually, to my bladder and pelvic organ prolapse. It quickly became obvious that there's not a lot of information, research, education for young women with prolapse. It's,
Yeah.
you go online and it's all doom and gloom about menopause and perimenopause. And so
Yeah.
I started this small Instagram hoping to educate people who are my age going through the same thing. And turns out there's a lot of us and a lot of people who are looking for
Yeah.
more info and wanting hope that their life can go back to the way it was before their diagnosis.
Ooh, that's so good. And it's so true because pregnancy and birth is a really, really big physiological event that a lot of us go through. And to get something like that and then to go online and to only see really scary things
Yes.
or really like long-term things can be really overwhelming to someone who's now facing an injury, taking care of children, right?
Yes.
Like we can't just like move on. Like this is
Right.
our pelvic floor. This is our life. This we like so how do you work with these people? So I'd love to hear, like it sounds like your own life story kind of led you to working with this population. So what like lights you up about working with this population? How do you see how do you work with them? And I love to hear because I'm sure there'll be people listening
Yeah.
that have their own injury. Is there hope? Like what can
Yeah.
we do?
Well, the first thing I say is it's extremely common. We just don't talk about it. And it's also
Yeah.
extremely common and people don't have symptoms. And so if someone comes to me with prolapse that's minor and they have symptoms, I actually tell them, you're kind of one of the lucky ones because you know it exists in your body and that means we can do something about it right now. And there's so many things that we can do. And so I educate them on pressure management in their body, right? Where we get their bowels under control. So no constipation, no straining. I help them with their strengthening their full body, maybe strengthening their pelvic floor if they need to. Teach them ways to continue playing and lifting their children as they're rehabbing and give them all of the information and all the different tools that we can use to help, recover from prolapse, whether that be a pessary, whether it be, you know, strengthening our glutes and core so that our pelvic floor can take a load off, right?
Right.
Improving our rib mobility, as we know, creating more space up in the upper part of our body can minimize pressures downwards. And I tell people, I'm giving you all these tools in your toolbox and you take them out and you try them. And if you like them, you keep them. If you don't, put them back. Everyone's
Yeah.
different, but there's such a variety of things we can do. And I think that gives people a lot of hope that they're not going to be stuck forever. And there's so many different modalities that we can try to help them become asymptomatic and get back to the things that they love.
That's so important. And I think I love that we're talking about it now. I think it used to be a really shame-based thing. It's like you wouldn't feel ashamed to go rehab your knee.
Right.
Like this is no different, right?
Yep.
And people just feel embarrassed and ashamed and they don't reach out for help. But you're
Yes.
telling us like there is hope and there is so much we can do. And
Yes.
it's not just going in vaginally, right? We open up the rib cage,
Hmm.
we get the glutes working. Like it doesn't have to be um I don't know, this scary, weird, awkward thing that I think a
Yeah.
lot of people think it is,
Absolutely.
right?
And there's so much more to the treatment. Like just the other day, I had a patient who was leaking, and I said, let's take your shoes off while you're jumping. And her leaking
Mm,
stopped because the shoes she was wearing was
interesting.
not allowing her to absorb shock through her legs, right? And so you need a PT who's going to
Yeah.
look at everything, not just tell you to strengthen your pelvic floor. So,
Yeah, and I think, that's the thing. If people go to a PT and they don't get relief or they get, like any profession,
mhm,
doulas included, like every profession, there's good ones and there's ones that maybe are still practicing the way they were taught 20 years ago in
right.
PT school. And we know things change so much. So like, how do you see that? Like the variety of ways we can be supported. I know for me, like I'll send people to different PTs and
Yes.
this one you like I learn which ones to send them to because there's still people doing like towel crunches and 100 Kegels, right? And
Right.
then there's others who like you are continuously learning and evolving and growing and like what's the evidence tell us right now. So I'd love to have you just chat with us a bit about like
Yeah. Yeah. Well,
the variety there.
the prolapse for people who don't understand like the physiology, I guess, and anatomy of what's going on is our organs are supported by ligaments and fascia, right? So that's from on top is what we can imagine. And once those tissues are stretched, sometimes even torn, like for a uterosacral ligament can actually tear.
Yeah.
Um, we're strengthening the pelvic floor. That's not actually going to put the organs back up, right?
Right.
But it's our
Exactly.
secondary support. So the pelvic floor muscles do need to be strong. They do need to be coordinated. But that's not the only thing because there's so much more involved in pressure downwards, right? So if someone
Yes.
is jumping and not absorbing shock well, if their pelvic floor is contracting, that's great. But if they're losing that shock absorption through their foot or their hip or all these other things, then there's going to be a cascade of effects, right? So I encourage people
Yes.
who maybe are still practicing the Kegels or the solution for prolapse to take a step back and look at the whole body as a system of pressure and pressure management. And yeah, just to challenge you to maybe don't even look at their pelvic floor for a few sessions and play around with something different, right? And be curious. That's what I teach all my students and the people that I mentor. I'm like, you just need to be really curious about the person in front of you. And if that means setting aside what you thought was going to work for them and trying something new, that can be really powerful too.
I love it. You're like speaking my language because that's of course exactly what we do in BRM too, right?
Yes.
It's
Yes.
not just prolapse, that's one thing, but it's about like
Yes.
not everyone also needs the same things to prepare their body for birth. Not everyone needs
Exactly.
the same things to help their baby through the birth canal during
Exactly.
birth, right? And I
Exactly.
think too often any profession, PTs, midwives, doulas, doctors, all of us, we kind of get like, this is the protocol. Like, this
Mhm.
is what I always
Mhm.
do.
Mhm.
Everybody needs X when we see
Right.
Y. And it's like, well, maybe, but these are all unique humans
Right.
with unique stories of
Yeah.
what their body has been asked to do,
Yes,
right?
exactly.
And I
And
don't know, you've worked with athletes. I used to work with athletes a lot as well. And it's like, of course, a gymnast and a swimmer don't need the same things.
right.
Those are just the random ones that popped into my
Yeah,
head,
but
right?
exactly.
Like,
Why
but
would we treat their pelvic floors the same? We shouldn't, right?
right,
Yeah.
right. And
Yeah.
they might be wanting something different out of their pelvic floor. Like a runner
Yes.
needs the shock absorption differently
Mhm.
than, I don't know, like a swimmer. Again, it's
Yeah.
like their
Yeah.
pelvic floor is just loaded differently. So why
Absolutely.
would we, yeah, work with them all the same? So you're a BRM pro as well, which is
Yes.
super fun. And
Yes.
that's the thing I love about it is we bring in people from all like sides of perinatal,
Mhm.
right? Like the PTs and the doulas and the midwives and the doctors. So I'd love to hear why you chose to sign up. Like what was like your curiosity that led you to this training?
Yeah.
And how did it kind of impact your practice?
Yeah, I work mainly with women with prolapse, right? So whether that be someone who's just diagnosed or they're moving into perimenopause, but so many of them have the question of, can I get pregnant again? And what's going to happen to my body if
Mm,
I do? And should I have a vaginal delivery or should I have a cesarean? And I never tell someone you should do this or you should do that, but I present them with what we know could or could not happen and what their body's telling us and how we can optimize whatever delivery they want, right? Because the person in
yes.
front of us, like that's that's a
What they
person yeah,
want. Yeah.
exactly. And so that's why I think our listening and our like true hearing of our patients and clients is like really the most important one of the most important things
Yes.
that we do is we sit down with them and we dig deep into their history and we unpack what happened to them potentially in previous deliveries or their history of pelvic floor, whether it be tension or trauma, things like that. And then we talk about what do you want? What are your goals? And if someone wants to have a vaginal delivery and they have prolapse, they are often very fearful of things worsening. So
Yes,
what I mean is they
yes.
think that potentially, whatever organ has shifted, let's say it's the bladder, it's going to completely come out. Or their
Yeah.
uterus, they're going to have a huge uterine prolapse after they give birth. Or even during pregnancy, with the hormone changes, that increase in estrogen, things become more lax. And I'm often
Mhm.
educating that, yeah, expect things to feel worse first trimester, third trimester, before, there's different things that can happen. And my intent with becoming a BRM pro was that I wanted to help people maximize their pregnancies with symptom management
Mm.
and help people feel really confident going into vaginal delivery in particular, because that's the scary one, right?
Yeah,
Um,
yeah.
knowing that we could maximize space in their bodies in pregnancy so that they're not having as many symptoms. That's going to set them up for success postpartum also. And
Yes.
then minimize pressure as best we can in pregnancy and delivery. So I really wanted to learn about the mechanics of how this baby is going to rotate and come through the pelvis,
Mm.
and how can we help this mom move her body with or without an epidural, whatever her choice is, so that we're delaying how much pushing she's having to do, and we're helping her body go through these movements. This is what I love. I teach patients, here's what we can do in the inlet, here's what we can do in the mid pelvis, here's what we can do in the outlet, and we practice them in pregnancy so that when
So
they're in
good.
labor, they go, oh yeah, okay, I did this one with Margo in the clinic and baby's here now, so I'm going to do this movement. And they know, and they can just go right into it because we practice it over and over and over again. And
Oh,
then I
that's so
also
good.
teach, like, I have them practice pushing. And so it's within my practice act to be able to palpate internally and have people practice side lying, quadruped. We
Mm.
practice in half kneeling. We practice all these different positions of pushing, and we figure out we do open glottis and closed glottis because there's a time and a place for both, right?
Right.
And
It's true.
oftentimes we figure out a position where they really can lengthen the pelvic floor and just let it get out of the way. And I just had one come back the other day and she said, remember how good I did in side lying? I gave birth in side lying. And it was
Wow,
so
that's so
awesome.
cool.
And
Yeah.
that it gives them so much more confidence, right? It's that fear that we were talking about with will things worsen? And if you can arm someone with confidence and tools and knowledge about ways that they can help themselves so they don't go into it feeling like, oh, I have no idea what's going to happen, I have no control, then I feel like their outcome, number one, in pregnancy, their anxiety is reduced. And then
Which is
they're
huge.
ready to go into it prepared. And then I think postpartum, they feel better too. Of
I
course, in
love
birth, we
that.
never know what can and will happen. So I often communicate with their doulas too. If they have a doula and they let me communicate with them, I tell them what my findings were with their body. But I really think that what I've learned in BRM has helped me encourage patients and help them manage truly like the mental health side of it. And that's been
Mm.
surprisingly very powerful. And I've noticed that not
Huge.
only am I helping them with their bodies, but I see this change in how they speak about their birth. And
Mm.
that's been really, really cool.
That's super cool, and
Yeah.
and it is so true that people are very fearful of giving birth when
Yes.
they have prolapse, and I've worked with a lot of that as well,
Yeah.
and then we go into a system that doesn't really typically understand things like pelvic biomechanics,
Right.
and so if they're going in and they don't have a doctor, a midwife, a nurse,
Hmm.
whoever, or a doula, or whoever that understands things like, hey, maybe let's not put you in a position that's narrowing this space and
Hmm.
having you push as hard as you can uphill.
Hmm.
Like,
Hmm.
I mean, it should be obvious, maybe. Like to us, we're like, of course we're not gonna push
Yeah.
against a closed space, but it's just
Hmm.
so it's just not in the mainstream yet. It's not
Hmm.
something that's even really talked about. I mean,
Right.
to us, we feel like everyone's talking about it because we're talking about it,
Yes.
but it's really not. And so these
Right.
people are scared to give birth,
Hmm.
yet we're not trained to support them. And so
Right.
they, the savvy ones are going to find you, or they're going to find BRM. They're going to find like the tools, they're out there,
Hmm.
but we just need, like, I want everyone to have the tools, right? Like every
Yes.
PT, every doula, every midwife, like we should all understand the mechanics of this and how
Yep.
to like just decrease the impact. So like you said, and I say the same, is like, let's stack the cards in your favor. Let's
Mhm.
take control of the controllables.
Yes,
Of course,
exactly.
we can't control everything about this birth, and there's no one right way to give birth anyway, right? So it's like, let's just give these people the tools to make the best, most educated decision for their body. And even like a cesarean isn't necessarily going to like make sure you don't get prolapse,
Right.
right? Because
Right.
I find a lot of that is pressure management during pregnancy,
Mhm.
right? It's
Mhm.
not just always about, definitely you can create issues with with birth, but
Mhm.
I can see people, who are like, well, why do I have prolapse? I've had all cesareans. And it's
Yeah.
like, well,
Yeah.
cesarean's not like an end all be all protect. Like, let's talk about that. I'd love
Yeah, sure.
to hear what you think about like cesareans will protect your pelvic floor. Like,
Yeah.
what's your thoughts on that?
Well, with the research we have, we do know that the biggest risk factor of prolapse is vaginal delivery, and that makes sense, right? There's that
Yeah,
baby
and
coming through the
especially how we
vaginal canal.
support it these days, right? Like, of
Exactly. Yeah.
course.
Yeah, of
Yeah.
course. And the second risk factor is often our genetics. So we need
Mm,
to really start learning more about hypermobility disorders and identify patients who might be more at risk of developing prolapse. And that doesn't mean that we should tell them to have C-sections, but those are the people we might really need to take a look at what is happening in their bodies and prep them for a more successful birth with as the least amount of pressure as
yeah.
we can. A lot of the micro traumas to the pelvic floor muscles that occur in birth, that's going to happen to everyone, right? It's like you over lengthen those muscles 3 times their resting length. And but there's ways that we can optimize reducing our risk of trauma and then
Yeah.
encouraging healing postpartum, right? And so
Yeah.
I never tell someone you should have a cesarean, but I will measure someone's like I took Taryn Hallam's birth what was a birth injury like risk course, and she talked
Mm,
about how we can measure someone's perineal body and their different ethnicities and how some people are more at risk of certain things than others. And so if we arm someone with saying, hey, your perineum's really short. Let's optimize reducing the risk of tearing on your perineum. Here's the ways that we can do that. Um,
yeah.
that's really powerful.
So powerful.
That's
Yeah,
really
just giving
powerful.
people
Just telling
options and
options.
tools
Yes.
and movements. And I
Yes.
love how you have them practice the movements in pregnancy,
Yes.
because we talk about that a lot. It's like the first time you're riding a bike shouldn't be in a bike race, right? Like,
Correct.
if you don't have
Yes.
access to a movement, you're not just going to be like intuitively finding it at birth.
Yep.
And so I
Yep.
love empowering that you empower people in pregnancy with
Yeah.
that.
And my patients always laugh, but I tell them once we practice the pushing, I'm like, every time you go poop, just practice this every time you
Just
poop. And they're like,
practice.
really? I'm like, yeah, that's the perfect time to practice. You're
Yeah.
going to hopefully do that every day. And then your body will
Yeah.
know what it's going to do when you're in labor. It's
Yes,
perfect.
it's so good. I love that. I love that empowered approach, and I love that you don't just focus on the postpartum. I
Yeah.
think so often we focus so much on rehab, which is important,
Yes.
but also prehab,
Hmm.
preventing issues, and also preventing further issues
Yes.
is
Yes.
just like, it should be a duh moment,
It
but
should
I
be.
think, I don't know, maybe it's this perinatal space
Yeah.
is not given as much research as some more like predominantly male issues. We
Hmm.
always say like there's a lot of research on male sexual health and there's a lot less research
Hmm.
on the female pelvic floor and health.
Yeah.
And so it's just,
Yeah.
and I think it shows you find the professionals who really want to keep learning and keep
Hmm.
growing and
Hmm.
like stay curious. And I
Yeah.
think those are the people, if you're like, well, I need help, who should I go see? Like, ask the questions. Like,
Yeah.
what does your PT, like, what's their way of approaching the
Hmm.
pelvic floor?
Hmm.
Do they have additional certifications? Like, what would
Yes.
you suggest someone do
That's a
if
great
they're looking
question.
for, yeah, like the right
Yeah. Like, how do
practitioner
you
for
know if you're
them?
with the right person? I said that
Yeah.
there's no issue calling an office and saying, "Hey, can I have a quick 10-minute conversation with your pelvic floor therapist and say, what's your approach to treating pelvic organ prolapse in someone who's postpartum or pregnant?" And if they say, "Oh, we do Kegels, we do biofeedback," and that's pretty much all they give you, maybe call someone
Mm,
else. and have a different
Yeah.
conversation. And if they give you all kinds of different things and they're talking about all these pressure management
And
and
you're like, well, it
breathing
depends on you and blah,
and it
blah,
depends,
blah.
yeah, all of
Yeah.
that kind of stuff, then you likely found someone who's going to be, like I said, more curious about helping you. And if I also want to speak to other providers, if you don't feel like you can treat these patients well yet, two options. If you don't want to learn how to treat pregnant and postpartum patients in this way, refer them to someone who does want to do that. Or
Yeah.
two, arm yourself with the knowledge, right? Take some
Yeah.
courses, find a mentor. There's always room for us to continue learning and helping patients too. And so you don't have to stop where you are. You can always continue and learn and help our patients. I mean, there's so much I need to learn. So much.
All of us forever, right?
Yes.
I always say, like, the more you learn, the more you realize there's a lot
You
more
don't
to
know
know.
anything.
Like, the
Yeah.
more you know you don't know anything,
Yes.
right? Like,
Yes,
like,
absolutely.
I think that,
Absolutely.
yeah. So I would love to hear just why, as a PT, you found it helpful to take a class not taught by a I'm not a PT, I'm an exercise physiologist. It's similar,
Yeah.
but like we focus a lot more on like the birth mechanics and the birth physiology.
Right.
So I would love to hear like why that was beneficial for someone who doesn't attend births, right? Like I don't think you attend. Well, you've attended some.
I've attended some. Yeah, I've attended a few of my friends. I've just kind of like been like a unofficial doula. I would actually love to become a doula because
Oh, you should.
I'd love to see my patients in pregnancy, be at their
all the way
birth, and then
through.
rehab
Yeah.
them postpartum. That would be like a dream. However, I still have a almost 1-year-old who doesn't sleep through the
Yeah.
night. And so I'm not in a phase of my life where I
Yes.
can be that for someone else when my family still needs me in that way, but eventually I will.
understand.
So
Love
yeah,
it.
taking a class from somebody else, I love learning from different professionals. I think it's really important for PTs to, if you look at if we look at our scope, your scope and my scope, it's movement of the human body, right? And if that's like a giant circle and all the things that we do, I'm like this little blip over here and you're this little blip and then they kind of overlap. But there's this huge amount of things that we know about the human body and movement that there's different specialists in, right? And it's okay that somebody is a specialist in something different and that they look at something a different way because it encourages our brains to do the same. So what we know with learning and with plasticity in our brain is if we can learn something new but build it off of something we already knew, right? So it's like we have this baseline knowledge and then we throw something new on top of it and relate it, we're more likely to remember it and for it to stick. And that's why I love learning from different providers, is because I'm not hearing the same thing from a PT over and over again. I'm hearing you describe something different and then I go, oh yeah, that one patient, I could have done that with her, or maybe that's what happened in that birth that I watched, or that one patient. Now that I'm seeing her postpartum, I wonder if she did this in her labor. And it just kind of brought me back to like the athletic training history and stuff like that. And it's like,
Yeah,
it was
I love
fun.
athletic
Yeah.
training.
Yeah. But it made my brain see and hear and watch things differently in your program. And I think it just reinforced my learning because it was different than
good.
hearing it
Yeah.
from a PT, if that makes sense. So
Yeah,
it
no, I
kinda-
totally get it because
yeah.
a PT is going to say it different than a doula, than
Yes.
an ex-phys, than
Yes.
yeah, we're
Yes.
all looking at things through a slightly different lens. That's why
Yes.
I too love just hearing other people's lens and being like,
Mhm.
oh, PRI talks about like this
Right.
shift. Oh,
Right.
I noticed that shift all the time. I didn't call it what they call it.
Yes.
Like we're all like kind
Yes.
of, the body is the body, the physiology is the physiology, and we're all just trying to like make sense of it. And
Mhm.
so learning like different things can just, yeah, it just helps your brain figure out its own thing. And I think the thing I like to teach in BRM is I don't like to teach people like, just do this when you see this, right? Like that's not helpful. It's like
Right.
explaining to them how to become a critical thinker of the birthing process, how to be a critical thinker of like, oh, this person has pain on their right SI, right sacroiliac joint. Well, why? Okay, what do I see in their body? Oh, interesting. Oh, and now they had an asynclitic baby. And you like start to just like unravel it all the
Right.
way through. And they're like,
Right.
oh, and then they pushed for 4 hours. Oh, and then what position did they push in? Oh, they had an OB. They were externally it's like, and then you just go on versus being like, oh, you have prolapse. Okay, I'll treat the prolapse. It's like, I feel like if you uncover these layers,
Yes.
and to me, like I love using the birth to figure out some of the patterns,
Yeah,
right? Because you're like,
absolutely.
the baby's following the pattern. So if you can like like learn. I don't know if all PTs do this, but I feel like everyone, if you are working with someone postpartum, I want to hear the entire birth story.
Yes.
I don't know if you do, right? You want to hear
the
like,
whole thing.
was there
All
a
of it.
stall?
Yeah.
Was there how long was
Absolutely.
pushing?
Absolutely.
Yeah.
And
What
I love-
information do you gain from that? Let's talk
Yeah,
about
I
it.
mean, it tells you maybe where there was tension or where there was something that wasn't moving quite well. Like one of the births I attended, long story, but she kept moving the same way, like opening her left hip, like shifting to the left, and she was unmedicated, and she only wanted her husband to put pressure, like proximating her femur into her hip joint, like only on the left. She had an
Interesting.
extremely asynclitic baby. Like
That's what I was thinking. I was like, if she's rotated to the right, the left is tight. Her she's like intuitively
move. Yes,
Isn't that so cool? Like
was
she
wild.
didn't consciously know that her left hip was tight.
And the midwife and I kept looking at each other like, do we need to? So we did some invert. We did. We tried things. This was before I was BRM pro. I would have done a lot more. Now that I know more, you always look back too, right, and think about those things. Of course,
that's fun though.
Yeah, super fun, super fun. But yeah, I always look at people's birth stories and then you feel it in their body, right? So you're trying not to like bias yourself and say, oh, I'm gonna find this when I touch them. But a lot of times after you do this enough times, you're like, oh yeah,
you just know where to go.
That's what I thought after what you told me. That makes sense. And then they go, oh yeah, that makes sense. And I often tell that to my patients, or I ask them, I say, is what I'm saying, is it like resonating with you? Does this sound like, is this fitting with your body and what you're feeling going on in your body? And more often than not, they go, yeah, like that. I didn't know how to describe it myself. Yeah. They're like, I didn't know how to say that, or I didn't know how to explain that to my provider or to my husband or whoever. And then you just explain the physiology and anatomy of it and they go, oh, that's what I've been trying to say.
I love that. And now if you're saying, let's say they found you and they had that asynclitic baby and that tight left hip, and then they're having like, let's say prolapse, and then they're now wanting to have another baby, and you can say, you have tools to be like, different baby. And and different pregnancy, different birth. And now you have some tools.
Yes.
Maybe let's work for the next many months to open up that hip to more balance out that space. And then let's give your doula or whoever, like, hey, these are some 3 tools to just have in your back pocket in case X happens again.
Yes.
Because right? Or like be a doula who knows that stuff, right?
Yep.
That's the cool thing about you talking to the doula, especially if it's a physiologically aware doula. You can just relay that like, hey, left hip, do this.
Yep.
And then that's just so cool. And if we could get all perinatal pros to like have that base level, like we could help protect so many people's bodies and make them so much more empowered.
We could. And I know that like we don't turn babies, right? We don't. Babies do what they want to do, but if we give them space, they're going to find a good spot. And I had a patient pregnant with her second, horrible tailbone pain since she delivered her first, all through her pregnancy. We resolved that by working on her pelvic floor. She had a breech baby. She went in for her C-section at 39, and baby had flipped the night before.
Funny. Because you did all the balancing stuff.
She went she got sent home, and then she had a beautiful vaginal delivery, and she's feeling better now than she has for years. And all it was giving baby the space that the baby needed, and trusting that her body would intuitively do what it needed to do, and we helped create the space. It was beautiful. Like, I could not believe it.
Cool.
It was so
I mean,
cool.
how cool that you were able to help her to be able to like meet her body in an empowered, embodied way. Because I think that's the other thing is too often we get as practitioners like, ooh, I did that. Like we made space. It's like, oh, we're just the facilitators.
Yes.
We're just like giving your body a few tools that like maybe are lost because modern society is like sitting at a desk in a computer all day and stressing out and not breathing into your ribs, right? And so we're just giving you the space that you deserve, the expansion you deserve. And that's just so cool. I love that. I would love to hear if you have any words of wisdom for other, specifically PTs, but just anyone in this perinatal space that's, like starting to see like things just more curious, and like they heard what you said and they're like, I want to be able to meet people in that way.
Yeah, I think number one, it is within our scope. to have these conversations with people. And I think a lot of
Mm,
practitioners might be hesitant. Just they're like, oh, well, that's the OB or that's the midwife's job. But
right.
really, what it is teaching someone about their body and how their body moves during a physiological process. That's totally within our wheelhouse.
Super. Yes.
Absolutely.
I can't think of anything more in your wheelhouse, right?
Exactly. And I think I guess what I was looking for in a course when I signed up for BRM was I wanted something that was going to cover all of it. Like
Mm,
pregnancy through postpartum, the birth physiology, the exercises we can do, the troubleshooting pain. I wanted it to be something that covered it all. And that's exactly what BRM did. And that I appreciated that so many of the tools, it's like you can use this tool in this situation to prep for birth, but it's also going to probably help with their pubic symphysis pain. And like, there's
right.
so
Yeah.
many, yeah, because these pregnant
the
women,
same
especially the ones who have other kids, like they don't got an hour to do their exercises every day.
Right.
They don't
Oh my
have
gosh.
an hour and a half to do the
I don't
miles
either.
circuit for 2 weeks before they give birth. Like, who has time to?
Oh gosh, let's talk about that circuit sometime.
Oh my,
right?
yeah,
I mean, like, I don't know how it's become like the go-to.
right.
It has its place. I should
It
like do a
does.
live sometime
It
and like break
does.
it down physiologically. But
Yeah.
just like resting in this one
so
position
static.
and then side and
Right.
then the other side.
Yeah. Yeah, and then the movement at the end is dynamic, but the other two are so I mean, if you have to rest, fine, that's a great position to rest in. But
Yeah.
yeah, I just feel nobody's got time to do that. And so let's give them some
Right.
tools, quick things
Something
that they can do throughout their
simpler.
day, something more simple that might help with two different things. But yeah, I think it gave me a lot of confidence to have conversations with patients and just give them confidence that I know what I'm doing, which means that they're going to know what they're doing. And that's really
Yeah, for
powerful. But
sure.
if someone asks you a question and you go, oh, I don't know, I think you should talk to your OB. I'd have no idea how to answer that question. That's okay. But find the answer
Yeah.
or find a
Yeah,
course
find
that's
the
going to help you
answer.
find the answer, right? That's okay for us to say, I don't know. But I think it's then our due diligence to find the answer and educate ourselves and educate our patients as well.
I love that. And I love PTs who are curious about learning about the whole physiological birth process because I
Yeah.
don't think that's covered in PT school. I didn't go to PT school.
No.
But they're not talking through the physiology of like baby rotating through and like what tissue they interact with at each leg of the journey,
No,
which
we're
is
taught
like,
that the SI joint doesn't move at all. That's what we're taught in PT school.
what?
Oh,
Are
heck
you
yeah.
serious?
Oh, heck yeah.
What?
Oh, yeah, girl, we could talk forever. And I'm like,
Oh
that's
my gosh.
not true.
So yeah, so all about, well, in every profession, like I
Yeah.
will tell you as an exercise physiologist, if I was like practicing now, like what I learned in school,
Mhm.
like I even cringe thinking back to 2 decades ago, but
Yeah.
also I know like I'm on a journey. That's how we were all working back then.
Yes,
So if we all
yes,
just stay
yes.
curious and keep pushing forward and
Right.
find the things that make you curious and explore them deeper, I think like, and just like, thank you for being part of this community of game changers. I feel like when we just all come together and we all are like, how do we make this better?
Yeah.
Right? Like from
Yeah.
our leg.
Yep.
Like I'm
Mhm.
not checking people's like pushing positions prenatally and like assessing that. But I need someone who can, right? Like we need you, we
Yep.
need me, we need the doula, we
Yeah.
need the midwife, we need the informed doctor. Like
Yeah.
let's all like stop competing and start like
Working
joining
together.
forces,
Yeah.
right?
Yeah. And the more of us who are starting to push this and make those changes for our patients, the more the OBs are going to hear about it. The more the midwives are going to hear about it and go,
Exactly.
oh, that went really well. Why? That went really well. Why? You know, yeah.
I don't know how I did that, but yeah. That's what
And
I meant to say.
yeah.
So
That's what I think. That's what I'm
Yes.
hoping for is that change, that if we start, others will join and we'll start to see a bigger change eventually.
Yes, I would love to hear where people can find you, work with you.
Yeah.
If you have courses, if you
Yeah.
have like in person, because I'm thinking someone's gonna be like, I need this assessment. I need to
Yeah.
learn from
Yeah,
Margo.
yeah, yeah. So I
tell
do
us.
in person in Ventura, California, so I could see you that way. You can find me postpartum pop PT on Instagram or p4moms.com is my website. P, the number 4 moms. And I also
Amazing.
do pelvic health coaching internationally for people who just want to kind of talk about what's going on with their bodies,
Cool.
troubleshoot some things. I'm often working with people virtually who have a physiotherapist or physical therapist, and they just
Mm,
want to talk to someone who really specializes in prolapse, and then they take what I've spoken with them about and
that's
they go back to their
amazing.
care team. So that's been really, really productive as well.
Yeah, that's a great resource. Well, thank
Yeah.
you for all that you're doing.
Yeah, of
Thank you for being
course.
part of our community as well. And I am looking forward to just watch you continue to show up and change the face
Thank
of
you.
especially prolapse health.
Yeah,
So
yeah.
thank you for what you're doing.
Of course.
All
Thanks.
right. Bye,
Bye.
everyone.